I'm Willa, and I will be talking about sexuality. So, in this day and age, most people have heard the following acronyms: LGBTQ, LGBTQ+, and LGBTQIA. These acronyms are much more than just letters on a page. They are symbols of inclusion meant to represent historically marginalized group of people. As times have changed and people have become more accepting, the language used to talk about sexual orientation and gender identity have also evolved. Today, there are many different labels that individuals use when discussing where they fall on the spectrum. The progress that has been made in the last 10 to 20 years has given many people the ability to feel accepted and loved in a community that supports them, but we still have a long way to go if we are ever going to eradicate discrimination on the basis of gender and sexuality. The first step is to make sure that people are educated. Most people who do not consider themselves part of the LGBTQ+ community have at least a vague idea of what the acronym stands for, but many do not have a comprehensive understanding of what each term means. In fact, many people who might be questioning their gender identity or sexuality may not fully understand how or even if they should label themselves. I'll also be discussing what it means to be cisgender, and I will talk briefly about heteronormativity. Please know that this segment is not an exhaustive resource, nor is it a substitute for face-to-face discussions with people you trust.
So what exactly does LGBTQ stand for?
That's a great question. The L in LGBTQ+ stands for lesbian. People who identify as women and who are sexually and or emotionally attracted to other women might label themselves thus. The G stands for gay. Gay used to be used as an umbrella term to refer to both women and men who are attracted to individuals of the same sex. However, today, most people use the term to refer to men who are sexually and or emotionally attracted to other men. The B stands for bisexual. This term refers to someone who is sexually and or emotionally attracted to someone of their gender or other gender identities. In the past, it was believed that people who identified as bisexual were simply on the way to becoming gay when they had identified as straight before. This belief has been largely debunked. T stands for transgender. This is considered an umbrella term that describes people whose gender identity or gender expression differs from the biological sex they were assigned at birth. It is important to note that trans identity may shift throughout a lifetime. Finally, Q stands for either questioning or queer. If a person is questioning, it means that they are uncertain of their sexual orientations or gender identities. The term queer was once a derogatory slur, but it has recently begun gaining acceptance in the LGBTQ+ community. People who identify as queer may want to recognize the fluidity of sexual attraction and or gender identity. Broadly, this term is used by individuals who want to bring more attention to the fact that their identity is beyond straight and cis.
So what about the plus sign? What does that symbolize?
Another great question. A note before we move forward. Although these identities are not stated plainly in the standard acronym, they are still considered a part of the community and are absolutely important to understand. Intersex is another umbrella term that describes people born with variations in their internal and or external genitalia, resulting in bodies that do not fit what society typically defines as male or female. Intersexuality is different from the rest of the terms detailed here because it does not refer to sexual orientation or gender identity. The term non-binary is also an umbrella term that refers to gender identities that do not fit within the binary of male or female. If a person identifies as asexual, it means that they experience little to no sexual attraction towards other people. This term is often confused with the term aromantic, which refers to individuals who experience little to no romantic attraction toward others. If a person identifies as demisexual, it means that they do not experience sexual attraction unless they formed a strong emotional but not necessarily romantic bond to someone. Pansexual is a term that refers to individuals who are attracted to people of all gender identities. Finally, if someone identifies as gender fluid, it means that their identity shifts or fluctuates. They might express themselves as masculine on some days and more feminine on others.
So all of this information is interesting and informative, but what's the big picture here?
The point of this segment is to make clear that many people do not follow a heteronormative path of sexuality. It may seem like the majority of people around you identify as straight or cisgender, but the reality is that many people who identify as part of the LGBTQ+ community are scared to come out because they are afraid of discrimination.
So do you have any other resources that you might suggest that could be helpful to families?
Yes. Along with this segment, we would like to suggest that parents and children take a look at something called the genderbread person. This visual aid may help guide families in their understanding of the sexuality spectrum. A link will be placed in the description box below. This is a lot of information, so don't feel bad if you feel overwhelmed right now. We would like to once again stress the importance of talking about the above information with someone you trust, be it a parent, friend, teacher, etc.
Hi, I'm Victoria, and today we'll be talking about relationships. So relationships can be really tricky. It's important to remember that you should always feel safe in a relationship. Keep in mind that a relationship can appear different for everyone. There is no normal What works for you and your significant other may not be the same for someone else's relationship. As long as everyone who's involved is safe, happy, and are equals, then it seems like we're off to a great start. Some schools include relationship education in their health classes, but if you do not have that in your curriculum, this video is a helpful tool. Dating relationships in adolescence is part of a normative development and can be a way to learn interpersonal behaviors. They are even important for your development of identity, peer relationship, and sexuality. Relationships take time and understanding. There can be healthy arguments when you don't always see eye to eye, and they can be fun when you do fun activities together, like watching a movie, bake, go apple picking, go to the beach, and other ideas.
So what are some examples of a healthy relationship?
So a healthy relationship comes up from respecting each other, mutual understanding, honesty and communication, trust and support. There should be healthy boundaries that are established between the individuals involved, and each partner is respected equally. A good partner will accept you for who you are. Support your choices, will give you advice for when you ask for it, and celebrate your achievements. A healthy relationship contains of outside interests, so your hobbies, education, and your work, and your friendships. So not all your friends have to be the same as your partner. Personal freedom should not be taken away.
So what are some examples of an unhealthy relationship?
So I like to start with this answer that if you find yourself realizing that your significant other is doing any of what we're talking about, please talk to an adult who's responsible and that you trust to seek help and to find options that are better for you. An unhealthy relationship is one where one of the individuals puts down the other. That can be, but not limited to, physical or psychological abuse. Psychological abuse can be insult, ridicule, hostile voice, blaming, threatening to break up, and the silent treatment. It can also include blame, feeling of jealousy, guilt, anger, accusation of flirting, and controlling behavior. This is coming from an article called Romantic Relationship Advice from Anonymous Online Helpers. A term that psychologists have brought up is monopolization, which is when your significant other keeps tabs on where you go and who you're with. Another is degradation, where a significant other slams your opinions down. And lastly, isolation is when your significant other ignores you as if you did not exist. Physical abuse or intimate partner violence includes, but is not limited to, someone with an explosive temper. So your significant other can be laughing and having fun with you, and then seconds later, he's screaming, he or she, or doesn't have a gender, is screaming in your face. It can be intimidation where one partner makes the other feel afraid. Mood swings, feeling a different range of emotions like happiness and sad, aggression, and physical hurting, causing physical pain to the other individual, like a punch, a tight squeeze, or even being pushed. No physical abuse is minor. There's also sexual abuse, where your partner may force you to participate in unsafe, unwanted, and embarrassing sexual activity. Even if you had consensual sexual activity before, if you do not want to continue the sexual activity, you can always say no.
So what are the differences between lust, infatuation, and love?
So lust is sexual desire, while infatuation is a fast or instant feeling. You know those butterflies you can't eat, you can't sleep type of feeling? That's what it is. But love takes time to grow. It is a strong and constant fondness of affection for an individual.
But what happens if there's a breakup?
So breakups are a part of a natural life. You may get hurt, but you'll get back up and you'll have learned so much from this experience. Remember, your life is not over. You had a life before your significant other, and you will continue to have a life after you and your significant other part ways. It's important to communicate and be polite towards this person. Even if you have a lot of negative feelings towards this person, it's okay to ask for space before becoming friends or just staying friendly to one another. Today, I'm going to be talking about sex. So, if you're not ready for sexual activity, that is okay. Listening to this may help you answer any questions you may have. This is a resource to help you, but if it's still important to talk to a responsible adult that you trust. If you're ready for sexual activity, make sure you're mature enough to understand the consequences of safe sex, like pregnancy and sexual transmitted infections, STIs, and other scenarios. So adolescents who are anxious about relationships tend to be more likely to engage in risky sexual behavior to attain intimacy and acceptance from the partner. Adolescents who are involved in sexual relationships at earlier ages than peers are at greater possibility of having more sexual partners, increasing STI risk and increasing unintended pregnancy risk. This is from an article, Contextualizing Relationship Education and Adolescent Attitude Towards Sexual Behavior, if you're interested in learning more. It's important to feel comfortable with your partner, and if you're ready to indulge in sexual activity, then have a conversation. It is also beneficial to talk to someone you trust. If you're not ready, open a dialogue with your partner and the adult so both of you are on the same page and that there is trust. It is important not to fall into peer pressure. There are verbal and nonverbal responses that can help resist. You can follow REAL, which is refuse, explain, avoid, and leave. I found this from an article called Resisting Pressure from Peers to Engage in Sexual Behavior. REAL can help in both substance use and sexual behavior. Refusing can begin with no thank you. You can explain why you don't want something, and you can avoid by doing other activities like going outside or hanging out in a group setting. Leave can include physically removing yourself or leave the location, which include hanging out with you and your significant other or whatever you're comfortable with.
What if birth control options are against my religious or personal beliefs?
There may be forms that are not against your belief. Finding the right one for you is important. Talk to an adult you trust and see what is right for you. We will be talking about birth control much later in the video.
So how do I know if I'm ready for sex?
There's so many factors that can cause someone to engage in early sexual activity, like peer pressure and curiosity. Remember, there's no rush. It's okay to wait. If you are not ready but want to express your affection, you and your partner can have intimate talks, holding hands, dancing, and other ideas. You will know once you're ready, when you feel like you're mature enough to take on different emotions and can take actions to prevent STIs and unwanted pregnancy. Remember to be sure you are ready before to engage in sexual activity. We strongly encourage you to talk to an adult you trust.
What if my significant other wants to have sex but I don't?
Again, there is no rush. No one should have sex out of fear or if you feel like you're obligated to have sex. Communication is key. The relationship you should have is an equal dynamic between the individuals involved to feel safe to express your feelings.
How can I avoid STIs?
You should also be ready to think about how to avoid STIs. If there is an individual who has male genitalia, there are male condoms available. They're all different types to fit your needs. If an individual has female genitalia, there are female condoms or internal condoms. If you're becoming sexually active, it is important to talk to your doctor about risks, other options to avoid STIs, and getting tested.
Hi, I'm Katie, and I'll be talking about puberty and periods. So puberty is defined as the time period in which adolescents reach sexual maturity. This occurs when an individual begins to produce hormones that flow through the body. This development of sex organs causes adolescents to experience many bodily effects. I will dive deeper into these specific changes that male and females experience throughout puberty. So puberty for men includes physical changes such as growth spurts, an increase in pubic and facial hair growth, an activation of sweat glands, a strengthening of the muscles, and the first production of sperm. Puberty for women includes physical changes such as growth spurts, increase in pubic hair, the activation of the sweat glands as well, and the first menstrual cycle, which marks the beginning of a woman producing eggs. So although there are many similarities between experiences of puberty for both men and women, one significant difference is that women experience their first period. Our society knows more about the broad cultural beliefs concerning periods rather than the personal impact menstruation has on girls. And there's also a negative interpretation of periods embedded into our culture. For example, people often blame periods for negatively impacting a woman's behavior or emotions rather than environmental factors or other possible outside sources.
Is it normal to experience puberty earlier or later than the rest of my friends?
Yes, it is. In fact, there are terms for individuals who experience these situations. There are early bloomers and late bloomers. Our society places a stigma on people who may identify with these terms. Early bloomers fear being judged for experiencing physical changes before their peers, while late bloomers fear being judged for experiencing puberty later than their peers. However, it is actually more common to be an early or late bloomer than one may think. The average age for women to experience puberty is approximately between 7 and 13-year-olds. The average age for men to experience puberty is approximately between 12 and 16 years old. Since these ranges are fairly large, it is not uncommon for individuals on either side of the spectrum to fear experiencing early or late puberty. However, in every statistic, there are outliers which can be caused by factors such as weight, diet, stress, level of activity, and genetics. It is important to remember that everybody's body is different and can react differently during puberty. If you find yourself experiencing puberty at a significantly younger or older age than these ranges, I encourage you to have a conversation with a family member, doctor, or another trusted responsible adult.
Is it normal to gain weight during puberty?
Yes, since individuals often experience growth spurts during puberty, it is very common for adolescents to experience a gain in weight as well. However, growth spurts occur at different times for everyone, so individuals may experience a gain in weight at different times.
What exactly are periods, and how do they affect your body physically and emotionally?
A period occurs when a woman begins producing eggs. Approximately every 28 days, a woman experiences a period. This schedule is called a cycle. If a woman is not pregnant and there is no source of fertilization to the egg, the process of a period will begin. This is when a woman's body discards the buildup inside the uterus and can be seen when blood exits the body through the vagina. Although this process is already a significant bodily change, periods can also cause other physical effects to the body. For example, cramps surrounding the lower stomach or lower back areas, swelling or tenderness of the breasts, bloating, and acne breakouts. Period symptoms can also include emotional and behavioral effects due to the flow of hormones through the body. For example, quick shifts in mood, feelings of confusion or uncertainty about bodily changes, a decrease in self-esteem, and a rise in sexual maturity. If you're experiencing any unusual or severe negative symptoms due to your period, I encourage you to immediately tell a trusted family member, caregiver, or doctor.
How does our current society affect our perceptions towards puberty?
Good question. One significant factor that affects society's perception of puberty is the media. As adolescent women and men experience bodily changes, the influence of media sets nearly impossible expectations for individuals to uphold regarding their body and appearance. Adolescents are surrounded by images of models who have been carefully selected solely based on their appearance. This constant exposure to people who have society's ideal appearance can affect adolescents' perceptions of themselves by causing a decrease in their self-esteem and confidence. Society also tends to focus on the negative aspects of menstruation, especially young men who are not fully educated on the experiences women face regarding menstruation. They often view periods as a disgusting or dirty topic of conversation rather than a symbol that marks the beginning of womanhood. These negative perceptions can impact a woman's perception of herself and her emotions towards menstruation.
So where can I learn more about this topic?
If you are concerned about how puberty is affecting you, I would suggest seeking advice or information from your doctor. They will be able to answer any specific questions, give medical advice, or explain your progress on a personal level. On the other hand, if you simply want to gain more knowledge about puberty, I would suggest asking a family member, friend, religious mentor, or other members of your community who are trustworthy and responsible. Another option could be resources such as books or websites. However, if you choose to use the internet, be sure that the information you are receiving is from an official educational website such as kidshealth.org.
Hi, I'm Anushka, and today I'm going to talk to you about pregnancy and possible ways to avoid getting pregnant. If you think that you might be pregnant, please talk to a responsible adult who you trust, or go see your doctor to discuss your options.
How can I tell if I'm pregnant?
Some of the symptoms that may be a sign that you're pregnant include missed periods, tender breasts, nausea or vomiting, fatigue, and peeing more often than normal. However, these symptoms are not a guarantee that you are actually pregnant. So if you feel that you are pregnant, please go see your doctor.
What happens to my body during pregnancy?
So pregnancy is split into 3 stages called trimesters. The first trimester comes with many bodily changes, including morning sickness, cravings or distaste for certain foods, mood swings, heartburn, weight gain, and swollen breasts. The second trimester is when your belly starts to grow as the fetus grows. So these bodily changes include body aches, swelling of ankles, fingers, and face, stretch marks, and itching of the abdomen. The third trimester brings on different symptoms including shortness of breath, hemorrhoids, trouble sleeping, the baby may kick inside the womb, contractions, and your breasts may leak.
If I do happen to become pregnant, what are my options?
If you happen to get pregnant and aren't sure what to do, there are 3 options available. The first one is, if you have a good support system behind you, as well as a stable environment to raise a child, you may be ready to become a parent and keep the child once it's born. If you feel that you really are not ready to be a parent and don't want to go through the process of being pregnant just to give away the child for adoption, abortion is an option as well. For some religions and beliefs, this may not be an option, which in this case, there's a third option, giving the child up for adoption. If you decide to not abort the pregnancy and have the child, there are many adoption agencies that you can contact that will help you find a family for the child.
How can I avoid pregnancy?
Due to biology, there are some people who actually can't get pregnant, but if you are one of the ones who can, there are many birth control options to prevent pregnancy. There are barrier methods such as condoms, diaphragms, cervical caps, and contraceptive sponges. For hormone methods, there's the birth control pill, which is most popular, vaginal rings, contraceptive implants, contraceptive injection, and birth control patch. There are also intrauterine devices, aka IUDs, that include the copper IUD or the hormonal IUD. If you're interested in learning more, talk to an adult you trust and a doctor. There's also the mayoclinic.org that can help you find more information on each method. Talk to your parents and your doctor to see which is best for you and your lifestyle and personal and religious beliefs.
Where can I get more information about pregnancy, or where can I get help if I become pregnant?
The United Way's hotline is a great resource if you have any questions regarding pregnancy or how to avoid pregnancy. All you have to do is pick up your phone and dial 211, and an operator will help you with any questions that you may have. And as always, talk to your doctor or a trusted adult if you have any concerns or any questions at all. That's it on pregnancy.
Hi, my name's Sammy, and in this segment I'll be talking about consent. So what is consent? According to the 2015 article by Jauskowski, consent is a clearly communicated agreement between two willing participants to engage in an activity. People generally talk about consent in the context of sexual activity, but it can apply to just about anything. But for this segment, we'll mostly be talking about consent in terms of sexual activity.
Why is consent important?
Consent is important because it shows respect for oneself as well as for one's partner. Relationships are about mutual respect, and the best way to show such respect is through listening to one another. Ignoring your partner's wishes or needs or comfort level does not show such respect. Communication and honesty make relationships, and this is especially important when engaging in sexual activity with a partner. Sex must begin with a yes in order for it to be consensual, and both parties must affirmatively communicate their willingness in order to participate in the activity or offer, and this is cited by Gilbert in 2018. As Bocci's 1992 article indicates, consent is important because without consent, sexual activity is considered to be sexual violence, which can take the form of either sexual assault or any unwanted sexual act done by a person to another, including unwanted touch of a sexual nature such as kissing, fondling, oral sex, or intercourse. Or this could take the form of sexual harassment. This is known as any unwanted verbal or physical conduct of a sexual nature.
What are some common misconceptions about consent?
The One Love Foundation, which is founded on the mission of educating youth on healthy versus unhealthy relationships, developed 5 myths about consent, and these include: number 1, boundaries aren't essential; number 2, consent is only about sex; number 3, silence means yes; number 4, there are no takebacks; and number 5, all is fair when you're drunk. These myths represent common misconceptions about consent, and it is essential that they be debunked. As we spoke about in previous segments, it's essential to establish rules and clearly communicate comfort levels with a partner. Relationships do not have to consume your entire life. It's healthy to have other friends and engage in other activities than the ones with your partner. Clearly communicating with one's partner is crucial in developing a healthy relationship. Consent pertains to everything, whether it ranges from holding hands, public affection, going on dates, kissing, or engaging in sexual activity. It's not strictly just for sex. Put simply, consent is the line you draw between what you're comfortable with and what you're not comfortable with. A consensual relationship is one in which both partners do not feel pressured to engage in activities.
Does the absence of a no indicate consent?
The absence of a no is absolutely not consent. Silence should not be mistaken for consent. As the definition states, consent is an explicit and verbal agreement between two people to engage in activity. And as we've been saying, clear communication is essential to maintain a healthy relationship and is crucial in consensual activities. Make sure you and your partner check in with each other when you're engaging in these activities.
What happens if I change my mind?
You are in control of your body at all times, and so you can stop whenever you feel you're uncomfortable. And a healthy relationship means you can change your mind at any time or for any reason. There should not be any pressure to engage in any activity that you're not comfortable with.
Is it consensual if alcohol or drugs are involved?
If consent needs to be explicit, then it's difficult to give a clear answer when you're under the influence of any drug or alcohol. As one Love Foundation asks, if you were under the influence, would you still feel 100% comfortable engaging in these activities with your partner?
So what is not consent?
Not consent is when someone says no, the absence of a no, saying yes while you're intoxicated or otherwise incapable of giving consent, not saying anything at all, and repeatedly asking someone to say yes or pressuring them to say yes until they do.
So what are some resources I can use to learn more about consent?
It's important to educate youth on the importance of consent, and some resources of education include one of the examples such as Green Dot at Connecticut College. Green Dot is a national violence prevention program implemented by the college in 2015. This trains students, faculty, and staff in bystander intervention to help prevent sexual violence, domestic violence, dating violence, and stalking. This encourages bystanders to make a choice and then take action by doing something to prevent such violence from occurring in the specific community. Built on the idea that in order to measurably reduce the instances of power-based personal violence, which often relates to non-consent, there must be a culture shift. Green Dot capitalizes on peer and cultural influence to encourage behaviors from those that sustain violence in our community. And this is one of the many examples of an education prevention program on school campuses, especially in colleges. Another resource to engage in is the One Love Foundation, and they often hold workshops for individuals to learn about healthy versus unhealthy relationship as it may relate to consent. There are many resources which shift the taboo nature of the conversation about consent to one that is essential to discuss during sex education. This concludes our segment, but remember, consent is sexy.